let's talk about the education piece a little bit. Let's talk about the public awareness because I'm not sure that most of the provider context out there has this level of understanding or at least this level of acceptance. You and I both know that the payers haven't until recently. So, what mechanisms do we need to do to bring this education to the patients, to a component of public awareness where they understand that your pain is profoundly more complex than what an x-ray shows or an MRI reveals?
hmm And I think, the simplistic way that people have thought about pain is, oh, I have an injury. It goes up my arm to my spinal cord to my brain, and ouch, it hurts.
Mm.
And that's just an overly simplistic view. And it really does come down to perception. And we think about, well, what can we do about perception? And what's really exciting is there's many ways that through the mind we can affect our perception of our body. So mindfulness, meditation, somatic touch, therapies like EMDR, internal family systems, the use of ketamine, and now psychedelics are coming down the pipeline as another way to completely affect the brain and how people perceive what's happening in their body and actually change what's happening in their body. So that's where I think
Oh,
the interface
yeah.
between us is going to be
Yeah.
so crucial, because these are new medicines that don't belong just to medicine, typical medicine, and they don't belong just to traditional
Wow.
psychotherapy or psychiatry. They belong to us, and it's
Yeah.
only if we communicate and work together in
Mm.
our specialties that will really be able to move that ball forward.